Welcome to Blue Talks.
A young man started his new job answering telephones at a hospital at night. The phone rings and he answers. "Hi, do you mind connecting me to the nurse for Miss Janet Smith? I'd like an update about her care." "Sure," he says. So he goes ahead and connects this person to the nurse. A few moments later, the nurse connects the call back. "Did you get everything you need?" he says to the woman on the phone. "Yes, thank you so much." The nurse was extremely helpful. "Great. How about I connect you to Janet and you two can talk tonight?" "Oh no," says the woman on the phone. "I am Janet Smith. It's just I'm the patient and I had no idea what was happening today." Now, as humorous as that can sound, that is often the experience of our patients and their family members when they come into the hospital. People often feel like they're just kind of dragged along. They don't know what's happening, who they're talking to, and what's going on. My name is Dr. Monique Nugent. I am a practicing hospitalist, which means that I'm a board-certified internist, and I only see patients in the hospital. I've practiced at hospitals on both coasts, at VAs, university settings with residents, private community hospitals, and I'll tell you, I see the same problems over and over again. I'm here to teach you a little bit on how to improve your hospital stay and improve communication with your hospital team during a hospitalization. Now, when I talk to people about hospitals, I use a lot of big and scary words. Fearful, intimidating, painful, needles. But there are some people who I talk to who use different types of words. Care, support, planning, comfort. What's the difference between people who feel overwhelmed and scared, who at the end of a hospital stay feel like they just are as more confused as when they started, and those who feel like they're the drivers of their care, and at the end of a hospital stay have gotten something accomplished, and they have a goal to continue working? The difference between those people are the ability for them to plan and communicate. So I'd like to suggest a few tips. One of the things I always tell people when they come to the hospital is you need a care partner. What is a care partner? Now, a care partner is different than a caretaker. A care partner is someone who's going to be an extra set of eyes and ears, an extra mouthpiece during your hospital stay, filling in the blanks and the details when maybe you're just too ill or in pain to do so yourself. Having a caretaker and not going it alone is really, really important. The second thing is to set communication goals. And I'm going to talk to you about how you can get the ear of your medical team in a hospital stay. Now, these tips I want you to take to heart, write down, and visit again. Setting communication goals, the first step is to consider setting those goals early in a hospital stay. What does that mean? It means showing up on day one when someone's in the emergency department, or if you're the patient and you're in the emergency department, reaching out on day one, not day 2 or 3 when you're feeling a little bit overwhelmed. So what does that mean? It means this. "Hi, doc, my name is Sarah. I take care of mom. I'm going to be your contact person through this hospital stay. I help her make decisions." Or, "Doc, do you mind reaching out to my daughter, Sarah? She really helps me out with making decisions and helping me organize myself. She's going to be my care partner, someone for you to touch base with during this hospital stay. Now I get it, showing up to the hospital is really difficult. An average hospitalization in this country is about 5 days, and those are 5 disruptive days, not just for the patient, but for their family members and friends. But you've got to show up. You've got to be present and make your presence known early in the hospital stay so your team knows who to reach out to. The next step is to tie communication expectations to an action. Something that's going to happen in your hospital stay that can drive the conversation and make every conversation a high value conversation where you're making decisions and moving things forward. So what does that look like? Hi doc, I'm Sarah. I help take care of mom. I'm going to be your point of contact through this hospital stay. Can you please call me after you speak to the cardiologist? Can you please call me after you get this CAT scan? You want to tie communication to something happening, an action, so you have something to discuss and continue to plan. Every conversation should be a high value, high impact conversation. And tying it to an action is how you're going to get those conversations going. The next thing I want you to think about is making these communication expectations reasonable. What does reasonable look like? Well, something I get often is, doc, we're a big family. I'm one of 8. Do you mind calling 3 of my sisters and 2 of my brothers when we're done with this conversation? Now that's great. I love the support, but that's not something that I can reasonably do. And it leads to a lot of different communications. Different people ask different questions, get different answers, and different understandings. I once had a patient's daughter say, I need to be called every single time my mother gets a medication. Where does that request come from? That request comes from fear. That request comes from the need to feel like you're in control. But that request is also unreasonable. Medication pass is a high safety point for nurses. And to expect a nurse to sit down and make a phone call every time she has to go into that room is setting that woman up for disappointment and the nurse up for frustration. Pick communication goals that are reasonable. So what does that look like? Hi doc, my name is Sarah. I help take care of mom. I'm going to be helping her during this hospital stay. Do you mind giving me a call after you've spoken to the cardiologist? And I'll make sure that I'm at bedside every morning at around 11. That way we can touch base in person. Reasonable. Ear, early, action, reasonable. Learning this way to communicate to your care team is going to make sure that you're driving each conversation. Learning to communicate this way with your care team is going to make sure that each conversation is high impact and helping you to drive your care. The last thing that sets the difference between the people who feel confused and the people who come out a little bit more pleased is setting the expectation for themselves for continuing a plan. Now, I often hear people say, I tell my patients, I tell my friends and family, you should never leave the hospital without a diagnosis. You should never leave the hospital without an answer. I push back a little bit on that. I want you to think, you should never leave the hospital without a plan. What is the next step? What are the things that we need to do afterwards? Because oftentimes after a hospital, things can be a little bit more confusing, a little bit more cumbersome. So set yourself up for success by clarifying that plan. So the 3 things that I really suggest you learn how to do to improve your hospital experience. 1, get a care partner. Somebody who's going to be with you, like I said, to be that extra set of eyes, ears, and an extra mouthpiece. 2, make sure you've got the ear of your communication team. And 3, make sure you're clarifying a plan for the things that are next. Thank you so much for inviting me here at Northwestern University to speak to you all. I really appreciate everybody's time.